Hello, my name is Priyanka from Let's Update Language Academy, and here with me is...
My name is Akhila John. I'm one of the trainers in Let's Update Language Academy.
So today we are here with the latest role play. I literally mean it because this role play card was asked in the examination. A similar of the kind was asked in the examination on 6 November 2021, and all those who have taken the examination can watch this, and who are about to take, and all those who are preparing for the examination, you can also try this and check how you perform. So shall we start, Agla?
Yes.
Okay, so the setting is outpatient clinic, and parent is really concerned about the 7-year-old girl. So parent has some concerns to inquire about, and we'll see how nurse address it and how she gives the solution for it. So you have 3 minutes as a preparation time. You can start the role play after that. I'll let you know when 3 minutes are up. You can ask me if there is anything you're not sure about. You can write on the role play card if you want, and you can use the pencil. You can look at the card during the test, but you must return it to me at the end of the test.
Okay.
So this is information for the role play card number 7. Please start preparing now.
Okay.
Thank you. You may start the role play now, please.
Okay. Hello, my name is Akhila John. I'm one of the registered nurse in this hospital outpatient clinic. Could you please tell me what brings you here?
Well, I'm here to talk about my 7-year-old girl. She often has this sore throat. So that's my concern, and I'm here to talk about that.
Okay, I understand your situation, and you will be having a lot of questions and worries. But don't worry, you can ask me. I'll be giving a detailed picture about what the process is. Okay?
Okay, alright, sure.
Okay, prior to that, could you please tell me that your child have had taken this throat swab before?
Well, no, this is the first time that she's going to have this throat swab.
Okay, that's clear. So, in that case, I'll be explaining you the entire process of throat swab culture or throat swab collection.
Okay.
Actually, it's a sample test taken. For that, a tissue sample will be taken from your child's throat. For that, we will be using a cotton wool bud for taking this tissue. And moreover that, it's a very quick processor, and also it only will cause slight discomfort.
Okay.
And for your information, there will be no risk of gagging is there. So far, is that clear to you?
Well, it is clear, but I'm quite concerned. This little bit of throat tissue can show what is wrong with my daughter.
Yes, as a loving mother, you are concerned about your child, and also that was a very relevant question. I am here to explain you what is the actual reason for the process.
Okay.
Okay, I'll be describing the analysis of throat swab. Actually, this is taken for culture to be sent in the lab. In that lab, we will be identifying with the chemical test what infection or what organism caused the infection to your child.
Okay.
So that only we can identify which medication can be given.
Yes.
Is that clear to you?
Yeah, that is pretty clear to me.
Oh, I'm glad to hear that. Then ma'am, could you please tell me that if your child is using a mouthwash?
Well, she's not using any mouthwash, but I'm curious to know why such a question.
Okay, I understand your worry. In this case, I'll be outlining about the effect of a mouthwash in this process or in this diagnostic test.
Okay.
Here, we are using mouthwash for killing the bacteria, not to avoid bacteria. Is that correct?
Yes, that is true.
So, in this case, if we are using mouthwash, this bacteria will be dead in our throat. So, the result will be compromised, so that we won't get the correct result.
Okay, I understand.
Is that clear?
Yes. But my serious worry is what happens if the throat swab shows my daughter has something serious.
I understand your concern. Also, I resist that actually I am not in a role to tell you what the exact cause. Actually, this is a diagnostic process. So, with this test, we will be only diagnosing what exact cause is. And till now, we don't know. We need the test result to be get. And the appropriate treatment will always be given by the GP.
Okay.
So, I am not the person to answer the proper diagnosis.
Alright.
I hope so far this is clear to you.
Yeah, that was pretty clear.
Okay.
So, when will this result be available then?
Yes, I'll be giving detail about the result and the time, exact time. Yes, the result will be out in 2 days.
Yes.
And the follow-up treatment will be given and the follow-up things will be detailed by your GP.
Yes.
And also he will be detailing about what are the prior next steps or what are the treatment we need to take.
Yes. Okay. I understand.
Is that clear?
Yes, that is pretty clear.
Okay. I hope so far everything was clear and I could provide you all the information, and so far your all worries are fine now.
Yes, I think all worries have addressed. Thank you so much. That is the end of your role play number 1, and you'll have a second role play if it is an examination. Okay, and regarding, I'll give you the comments on the presentation by Akhila. She was very confident with the sound. She had a very dominant sound, and which the patient could patiently listen to her. She was explaining very well, but I think you forget to ask the name of the patient as well as the child.
Yes.
She was doing it before, but she forget it this time.
Yes.
So that is very important. You really need to ask the name of the child as well as the patient. Again, she was addressing all my concerns, and her response and the consolation, the way she consoled me was excellent, and she kept the order and covered all the topics. She was really stuffed with information, and at the same time she was very much keen on noting that everything is clear to me. So that was a very nice presentation, Akhila.
Thank you.
So thank you so much. For more videos, stay tuned. This is Let's Update Language Academy.